But it's very clear that the number one killer in many places happened to be of pink color. What is it? Heart disease. And yes, that's the reality. Look at this very interesting study. These are people that died of violent deaths. In other words, an accident, bullets, and things like that. And when they did an autopsy, these were young people. These were young people, the ages 26 plus minus 6. In other words, from 20 to 32 years old. Notice what they found in these young people. They had 78% of them, their artery of the heart had atherosclerosis. Okay? Not only that, 50% narrowing of their artery was found on 21% of them, and 75% narrowing in 9% of them. And that is a reality. This is a problem that we are seeing from very, very young. And when we talk about heart disease, this is the part of the body that gets disease. If you take an artery, you cut it, and you open it, the inside layer is what is called the endothelium. How fast you're gonna age depends on the health of your endothelium. Think about it. See, the blood is circulating through the artery, and then every organ in your body is dependent on good circulation. So when the blood vessel gets close to a certain organ, then the nutrition, the oxygen crosses, and then is able to reach the different angles, different organs. But if that endothelium is diseased, is clogged in, is sick, that interchange of oxygen and nutrients cannot take place very efficiently. And this is what ends up happening. See, you have your blood vessels, and it's just like here in Australia. I've seen that when you are driving around here, you're going to see a bunch of police on the side of the road, isn't it? They have their cameras and so forth. No? So, in the same way, you have the arteries, and on the side of the arteries, you have this part of the immune system that is just watching to make sure that everything is going well. But when there is something by the name of oxidized cholesterol, we'll be coming back to that concept in a moment. When you have oxidized cholesterol, as soon as the body detects that there is oxidized cholesterol, your immune system goes ahead and eats that oxidized cholesterol because it's very toxic. It's not good that this oxidized cholesterol is circulating around. And what ends up happening, it's so toxic that the body cannot get rid of this. So the immune cell dies with that oxidized cholesterol inside of it, and that's where it stays. Now, if you were to eat oxidized cholesterol, man, once a year, it's not that big of a deal. You know, just a few cells here and there are going to be damaged and so forth. But oxidized cholesterol on a regular basis is not a good idea, because then all this oxidized cholesterol just accumulates and accumulates and accumulates, and you will end up getting yourself in really big trouble because of that. And I've done some research. This is my study. We were documenting how cholesterol goes down quite fast when you change your diet and your habits. In a matter of 2 weeks, in 2 weeks, you can see significant decrease in your levels of cholesterol. And this is my patients that they were able to make those positive changes and be able to reverse this condition. And not only that, this one we're showing that when people come to our residential program, they're able to improve their lipids quite nicely and quite fast. In fact, this other one of my studies, this one I did it when I was in medical school. Later on I published it, But originally, I had to go from 4th semester to the 5th semester. And they required a research project from going from 4th semester to 5th semester. So they told me, you need to talk to your advisor to see what type of study you want to do. So I went and talked to my advisor, and I told him, I want to lower the cholesterol using diet. I told my advisor. You know what he told me? Ramirez, don't waste your money. Cholesterol doesn't go down unless you take medication. I had worked in lifestyle centers some years before I went to medical school. So I told him, look, I'm going to be paying for the study, so I want to do it. And I was able to convince him to give me permission to start the study. But according to him, you couldn't lower cholesterol unless you use medication. Well, this study proves him wrong. Every single person that participated of my study, guess what happened? Their cholesterol came down. In fact, the local newspaper even ran a whole article about it, showing how cholesterol does go down when we deal with the root cause of the problem. And this is the problem with heart disease. See, we are learning that heart disease starts since the person is a little child. If you're giving that child the wrong types of food, we'll come back to that in a minute, that will stimulate the creation of cholesterol, and then that will start the process of atherosclerosis. And as we were seeing a minute ago with the different studies, the heart disease starts to progress. And not only that, this is the sad part. Many people can have severe type of atherosclerosis and they don't even realize. Not until your artery is about 70% closed, that's when the symptoms start. And the problem is that once the symptoms start, the heart disease is just around the corner. So don't wait until you have the symptoms to make the changes. You need to start the changes ASAP, because the complete closure, when this clocks in, that's when you have the definition of a heart attack. And it is very well documented. Anybody with a cholesterol of 3.8, that's the numbers that you guys use here in Australia, anything above 3.8, there is a linear correlationship. The higher the cholesterol, the higher the risk of a heart attack. That's why what we have learned from a study in America by the name of Framingham, that's the name of that study. Basically what they did, since the 1940s, they took a whole town in America, that's the name of the town, Framingham, in the state of Connecticut. And since the 1940s, they have been following those people since then, taking blood samples, doing food questionnaires, trying to understand, what diseases they have and so forth. So they've been able to put 2 by 2 together. And that's where we learn about this 3.8 cholesterol. Nobody with a cholesterol of 3.8 and under has had a heart attack in the Framingham study, which makes it a good goal. So your goal should be 3.8 or less. So where do you get your cholesterol? And we'll be coming back a little bit more about it. Anything that comes from animals has cholesterol. As simple as that. If it comes from plants, from nuts, avocados, vegetables, fruits, legumes, doesn't have cholesterol. As I mentioned to you, I'll come back a little bit more about it. And we know that when you see, for example, in America, you can see that heart disease is a tremendous killer. And this study, what they were showing, how tobacco, poor diet, and no exercise and alcohol was the main causes of why heart disease was appearing. And let's play a little bit the archaeologist. As you can see, since the time of the mummies, they had many of the similar diseases that we have today. For example, which problem this Egyptian has? In Mexico, we call this the tires, we call them. Okay. So you can see that this Egyptian had a significant problem in his weight. Now, question, who was the one that ended up as a mummy? Was it the average person, or who was the one? It was the elite, isn't it? The big business person, government official, and so forth. Those are the ones that had the problem. Look at this one. This lady grabbed a piece of cholesterol from the artery and is pulling out that junk that is coming out of those arteries. Which means that these Egyptians also had problems with heart disease. And this is what we were talking about it a minute yesterday. How those young people are having problems with their cholesterol, and this is something that is affecting many young people today. And look at this statistic. 2/3 of all the deaths that happen in the U.S. are related to diet, which means that in my home, I have something very dangerous. It's called the fork. Why I'm, putting my fork on, it's either increasing my risk of disease or increasing my risk of health. And this is the problem. See, this is an image of the artery, the biggest artery in your body, the aorta. Why? There are some people that you analyze that artery, and that artery looks like this. Look at that. It's all this atherosclerosis in that artery. At the same time, there are some people that when you analyze that aorta, their artery looks like this. What's the difference? Is it because of good luck? Not necessarily, It has to do a lot with choices. So tonight, I want you to analyze this. What type of choices are you making? Are you making the choices that are harming those arteries, or are you doing the choices that are keeping those arteries nice and clean? And as I mentioned to you, the health of your arteries has a lot to do with your quality of life and with your longevity. Studies have shown the following. You know that back pain that many people have, especially as they come to their 50s and 60s? The majority of those back pains are directly related to atherosclerosis. See, as the artery starts to clog in, the blood flow to the articulations, specifically of the back, cannot take place very efficiently, and that starts to deform that articulation. And instead of joints that are nice and smooth, you start causing these peaks and valleys in those joints, and it starts to become quite painful. So not only this is good for your heart, but it's also good for your articulations. I noticed something very interesting. When the person changes their diet, it's so interesting that many of those joint pains start to decrease or disappear. And I've seen this so many times. You know, I've been in this for 28 years. So here you can see what happens, what we were talking about a minute ago, when that LDL cholesterol, when it's oxidized, that's when it's the most toxic. Now, interesting study that was done. Who do you think has higher levels of cholesterol? Do cows or humans have higher levels of cholesterol? Humans actually have higher levels of cholesterol. But when we talk about oxidizing, what do you need to oxidize something? You need oxygen, so you can oxidize it. So whenever I have cholesterol exposed to air, that causes oxidation of that cholesterol, okay? And then we said where the cholesterol comes from. What do we say? Animal products. So animal products exposed to air will cause that oxidation. Yet the interesting thing is that if a baby is fed breast milk, which should be, the number one priority, where you should be giving as food to your baby, if you think about it, the milk doesn't have a chance to get oxidized because it's coming out what? Straight from the breast to the mouth of the baby. So if you want to have, cholesterol, non-oxidized cholesterol milk from cow, what you need to do? You need to hang in there. Now, because of hygiene purposes and some other factors may not necessarily be the best thing to do, okay? In fact, today, to me, there's no excuse, because today, there's so many options in the market. You can choose there. There's oat milk, nut milk, soy milk, all kinds of different milks. In fact, you can even make your own. Here's a recipe. You put water in your blender. You take some bananas. You put them there. Put a little bit of sweetener and a little bit of salt. You blend that. There you have banana milk. Okay? Simple. Very, very simple. So then, when the LDL cholesterol, we were talking about a minute ago, as the oxidized cholesterol is circulating here, the immune system eats that, and then it becomes these foam cells, as it contains that cholesterol inside, And as I mentioned to you, they're going to die, and that cholesterol is going to remain there. So then, after creating that atherosclerosis in the body, instead of the arteries being nice and smooth, notice what happens. You create all these peaks and valleys, and all these are those foam cells that I told you a minute ago that ate the cholesterol. It's so toxic they couldn't go anywhere, and they start accumulating there. Now, you think it's good that you have your arteries like this, like peaks and valleys? Not necessarily, isn't it? Because this causes even the blood cells to bounce around there. You actually end up damaging them earlier than what you should. Now, if you go to Mexico City, there was an artist there by the name of Rufino Tamayo that liked to paint the life of the Indians of Mexico. And this is one of his paintings. Question: how many overweight or obese persons do you count there in this picture of Rufino Tamayo? Not a single one of them. But you know, sadly, today, many people, as they start to gain weight, that starts to trigger inflammation. Remember, we were talking about that 2 days ago. And inflammation also stimulates the creation of that atherosclerosis. Now, I remember the first time I went to Africa. This was back in in the year 2000. I went to Tanzania, and we went to very rural areas of Tanzania. And you could see a lot of children there, and I took this picture. We were giving some, health education there in the schools, and how many children with overweight or obesity can you count there? And it's very interesting to me, because today often comes a mother that brings their child to me, and they tell me, "Doctor, I think that my child has parasites." And I ask him, why do you think your child has parasites? "Well, look at how thin he is." So I take the child, we take their height, we take their weight, and there's these standardized tables that we use to know, if somebody is overweight, underweight, or where they are. They are completely normal. So why is the parent concerned? Because the other children that are friends with this child, what happens to them? They're overweight. So compared to the overweight friends, this child seems abnormal. And we're changing the definition, isn't it? Now, abnormal is normal and normal is abnormal, because that's what the people get used to it. And they took us to eat, and this is typical food they eat there. They're eating this not because they are reading the latest, magazine and so forth, but this is the food that was available there, which consisted of a big pot of beans, a big pot of avocado, a tortilla-like thing called the chapati, and then some fruit, and then some sauce that you put there on those beans. That was their food, Very, very nice and healthy. And another thing that they would do, I noticed, is that they did a lot of physical labor just to survive. There's no running water there, so where did they get their water from? You saw them there in the roads with their buckets, walking kilometers and kilometers to find a source of water. If you wanted food in the area that we were, there were no food markets. So every single family had to cultivate the ground in order for them to produce the food that they needed. In fact, when you went and visited their villages, you would see that they have their places where they would live, and there was a huge space in which they cultivated things such as corn, such as pumpkins, such as beans, such as greens. Every family had that. Now, you have the same genetics, and you move the environment, and you end up with things like this. It's the same genetics of the people that live there in Africa. But as you change the level of activity, as you change the richness of the diet and so forth, this creates a problem. And sadly, many people live out of refined food or ultra-processed foods. And these foods are not good for you. And this has had an effect in many places in the world. Let me share with you this interesting story. In 1954, in the Marshall Islands, a place not, horribly far from here, the U.S. government decided to study the effects of atomic bombs. So what they did, they created these mock cities, and then they deploy some of those atomic bombs, and then through cameras and sensors and so forth, they could see, what effect does an atomic bomb has on buildings and different construction materials and so forth. But as they were doing that, unfortunately, the radiation from those bombs started to affect some of the populations nearby. And the people there started to get sick secondary to that. And because of that, the Marshall Island government took the American government to court because they had harmed, some of their population. And of course, there's videos and everything about this, so the American government lost the suit. And now they had to pay significant amount of money to those people in the Marshall Islands. Now, if you were to live in those islands, these people were living, a simple life. And what are you going to do with so much money? I mean, there's no malls and places there to go and spend all that money. So what they did, these people in the Marshall Islands, they got a bomb this time, but a bomb of food. And they started importing all kinds of things that their ancestors never ate. And they switched their diet from a diet consisted of fruits, lots of roots, a few products from the sea. Now, if you ask them what's their favorite food, Spam. This is like one of the worst of the worst. That's the reason why in your email it goes to spam, It came from that word. Okay? Frozen turkey tails, all this junk food. And sadly, the Marshall Islands today has the highest rates of diabetes in the world. From a place that it was literally unknown. Nobody knew what was diabetes. And now their lifestyle has changed completely there in the Marshall Islands. And it's common to see, soft drinks and ultra-refined foods and fried foods and all kinds of sugary foods. And statistics say that 90% of the people in the Marshall Island either have diabetes or pre-diabetes. It's just causing a tremendous devastation there. So they switched their natural diet, and today the majority of their calories are coming out of ultra-processed foods. And the sad part about it is that the Marshall Islands doesn't have the infrastructure to handle so many diabetics. So it's a sad picture to see so many people amputated, so many people losing their eyesight, and so forth. So what is diabetes? Diabetes is basically when there is too much glucose circulating in the blood. And the way that we measure this, we take two steps. Either you're gonna start as a pre-diabetic with a 5.6 to 7 if you're fasting glucose, or if it's more than 7, that is what we call diabetes. And you can see here the amount of internal fat in your abdomen is related to the diabetes. So the more fat in the internal organs, the higher the risk for type 2 diabetes. Also, another source of atherosclerosis is what is called the trans fats. These trans fats are not good for you. Trans fats, think about solid fat. For example, vegetable shortening, that fat that comes from vegetable, but is solid, it's not good for you, that one. That one stimulates the atherosclerosis in the body. And we know that not only heart disease increases as cholesterol goes up, Alzheimer's also increases. And the reason why is the following. The arteries that nurture your brain, as they get atherosclerosis, there's not enough blood flow arriving to your brain cells, and your brain cells need a lot of oxygen and nutrition to function properly. And because there is not enough nourishment arriving to the brain, that causes damage to the nerve cells in your brain. So one of the problems is that many times the approach of the problem is the wrong approach. Let's say that a faucet broke and the water is coming and coming to the point that it's starting to spill out in the ground. I can have two strategies to solve this problem. Strategy number one, I can use the latest technology in mops to try to get as much water as possible from the ground. Okay? It's one way to solve it, Not very effective, isn't it? But it kind of solved the problem. This is trying to solve the problem of cholesterol and heart disease just with medication. You're capturing some of the water that is there. You're lowering some of those numbers in the cholesterol, but in my humble opinion, I think that it would be better to ask the question, where is this problem coming from? And let's go and solve the root of the problem. The problem doesn't lie on the fact that there's water there. Yes, it's problematic but that's not the source of the problem. The source of the problem is this faucet. I have to stop that water from coming out of there. And this is how lifestyle medicine deals with this problem. Dr. Mr. Lincoln in America says, you cannot help men permanently by doing for them what they could and should do for themselves. Isn't that a wise counsel from Abraham Lincoln? So, Dr. Dean Ornish demonstrated very clearly the following. You know, unfortunately, many health professionals don't know nutrition. It's the reality. I mean, I went to medical school, and we have just a tiny little bit of nutrition. The place that I learned nutrition was at the lifestyle centers. That's why I know about these things. But because they don't know nutrition, many times when you have high cholesterol, what is the doctor going to tell you? You need to eat white meats. Have you heard that? You know, eliminate red meat, but just focus on red meat. Well, they did this study. They compared two groups. One group was following very carefully the counsel of the, low-fat dairy with some white meat and so forth. If you follow that very closely, this is what's going to happen to you. They discover that after 4 years, only 6% their cholesterol came down. Okay? In fact, when they tested the arteries, they documented that 79% of them, the atherosclerosis continued to progress. Is that a good program or a bad program? It's a good program if you're a cardiologist because you're going to make lots of money, put in stents and all these procedures you can do on the patient. But for the patient, it's not the best program. In fact, when they continued to follow up these patients, and they were doing imaging studies at the level of their heart to document what was happening at the level of atherosclerosis, it was found out that after 3 years, 41% of them continued to have progression. After 5 years, 65% of them had progression. After 7 years, 77% of them had progression. And after 10 years, 85% continued to clog their arteries with this. And this is what I see also. Many times I come to see some patient, and the patient tells me, "Doctor, I am eating so much chicken that I feel I'm going to start to get some feathers." And I don't understand why my cholesterol is not going down. Well, it's not going to go down. It's too much cholesterol. We'll put a little bit of numbers in a minute. Familiar things happen, and mankind does not bother about them. It requires a very unusual mind to undertake the analysis of the obvious. And this is what happened. So they compare those people following very carefully the normal counsel of, white meats, low-fat dairy, and so forth, against, this is the other group they compare against, somebody eating maximum 5 milligrams of cholesterol a day. Okay? This is what's going to happen if you're able to do that. After 1 year, you can see that now the numbers started to improve dramatically, and 82% of them, their arteries started to heal. 82% of them experience reversal. 14%, no change, which is a gain, because the problem is no longer getting worse and worse and worse. And only 4% actually continue to have progression. And these ones probably had some sort of emotional problem that they had to deal with that. And So then if you are eating 200 milligrams of cholesterol, you will continue to have progression of that plaque. So then, how many milligrams we said should be the goal? 5 or less. 5 milligrams of cholesterol or less. So among the things that they were doing, they were following a low-fat, full plant-based diet as a result of the therapy. This group that I just showed you that experienced this reversal of atherosclerosis, they had stress management, smoking cessation, moderate exercise, and social and emotional support. So let's go and put numbers to the foods. We said what? 5 or less. So let's see. If we talk about fruits, if we talk about grains, if we talk about nuts, if we talk about vegetables, none of them have cholesterol. So they're welcome in this program, isn't it? If we want to reach that 5 milligrams of cholesterol a day. Now, non-fat milk, 4 milligrams. 2% fat milk, 18 milligrams. Whole milk, 33 milligrams. Egg white, 0. Mayonnaise, 8. Ice cream, 29. Now, remember that I mentioned to you about the oxidized cholesterol? When you mix milk with sugar, you oxidize that cholesterol, which happens to be the breakfast of many people. You have cereal that has sugar, and then you add milk, isn't it? You are oxidizing that food. Butter, 31. And look at how much cholesterol has an egg. 213 milligrams of cholesterol. What did we say? What's the goal? 5. Man, you're eating your month's, long cholesterol in just one sitting down. Tuna, 26. Clams, 57. Crab, 64. And here is the myth. Notice this. Chicken without the skin, how many milligrams? 73. What about pork? How much? Is there much difference? You're just deceiving yourself, isn't it? Beef, how much? In fact, chicken with the skin, how much? So no wonder why the person doesn't heal. You're putting too much cholesterol. Your arteries are not going to heal like that. Oysters, 84. Sardines, 120. Shrimps, 165. And then the internal organs, they're just loaded with cholesterol. The kidneys, 329. The liver, 410. Caviar, 500. It's a bomb of cholesterol. In fact, the highest cholesterol-containing food happens to be the brains of the cow. In Mexico, they eat the beef brain taco. And as I tell my friends, don't eat that. You're going to end up acquiring the intelligence of the cow, by eating this, Avoid that food. It's not good for you. So this is what can happen to you if you change your lifestyle. This is Dr. Essenstiel study, and you can see here this patient had the artery of the heart. Notice how it's nice and big, and then suddenly it becomes thin. The reason why it becomes thin is because there's a huge plaque of atherosclerosis all over here. Now, this is the same patient 32 months later. Notice what happened to his same artery. What pill did he take? No pill. What he did, he switched his diet to a full plant-based diet. He stopped coffee. Coffee will stimulate atherosclerosis. And he started to do exercise and started resting enough. That was enough for that artery to heal. So as you can see, there is hope. There is absolute hope. As we change the way we live, we can experience this healing process in each one of us. Let us take a break, and we'll come back in 50 minutes. Thank you very much.